Hey, everybody. I wanted to talk today about night guards and bruxism, night grinding, clenching, all of those things that pertain to the relationship between your top teeth and the bottom teeth and the muscles and the musculature and how that can affect your muscles and your back and your neck and even your posture, your eyesight, how you sleep, how you re-energize yourself, how you rest, and bruxism or grinding is a well-identified pathology, let's call it, in dentistry. Now, I have a different take on this, and my take is that bruxism, grinding, is not an illness; it is a symptom. It is a symptom that something is wrong between the relationship of your top teeth and your bottom teeth. And I want to start breaking this down. So, it is my belief that if you have a balanced bite and that your top teeth fit perfectly into your bottom teeth, and everything is okay, and you've never had any dentistry done, and everything's fine, that bruxism is actually quite rare. And I'm saying this with anecdotal experience. I've been doing this for 22 years. You can find literature on anything. Well, if you want to find something, you'll find it. So I'm talking about my experience in doing this with tens of thousands of patients over 24 years, that I very rarely encounter this in a person who's never had dentistry done. No fillings, no braces, no orthodontics, no extraction. It's very rare you find this problem. So usually the trend in society and around the world is that if you have bruxism, it's associated to stress and dopamine and anxiety, and you're getting out your anxieties at night through your teeth. There's even some studies that show and some discussions that show that grinding is a way that our body has to ask for minerals by releasing ions of minerals from enamel, calcium, and all of that stuff. But let's discuss most of the grinding or clenching, and I want to discuss the two in a bit, but most of these pathologies I'm finding in my adult patients, and I'm going to say an adult after the age of 18, happens when they've had some dentistry done. What kind of dentistry? Well, a filling or a crown or an implant, a crown over an implant, or orthodontics. And why does it happen? Well, it's very simple. Our brains don't know what dentistry is. After millions of years of evolution, dentistry's only really been around properly for, let's say, 100 years, like a proper, mechanical dentistry of doing fillings and crowns and all of that stuff. And in that time, our epigenetics or our genetic sequencing hasn't upgraded our brain to understand, oh, that's a filling. It's cool. The dentist might have left it a little bit high. Don't relax. Don't worry about it. Our brain doesn't process that. What our brain is going to say is, what the hell's that? There's something in between my teeth. And when you're resting at night, or when you're not thinking, and our parasympathetic, so that the part of the brain that we don't control kicks in, our brain's going to try and say, let's try and there's something there. Let's get it out. Probably thinking that it's leftover food or a seed, acting as if we were still cavemen 10,000 years ago. It's like there's something there. So again, I don't see bruxism or clenching or grinding or clenching in patients that haven't had a lot of dentistry done. I do find it a lot in patients that have had orthodontics, extractions, and dentistry done. So let's go back in time, 60s, 70s, 80s, 1960s, 70s, 80s. One of the most common dental treatments done was a lead mercury filling called an amalgam filling, those dark fillings that we have in our teeth that over the last years people are removing for cosmetic reasons or for the right one, which is to get the mercury out of your body, and hopefully under the safe mercury amalgam removal technique. But we'll get into that in another conversation. But the good thing, the only good thing about those fillings was that they were soft in the first 24 hours. So what the mercury would do, and a very, very clever material, by the way, just highly toxic, that the mercury, when you put it into the tooth, it would keep that lead mercury, it's got a lot of stuff, that's why it's called an amalgam filling, would keep it soft for roughly 24 hours. So the top tooth would calibrate it, would grind it into position, not creating any tension there. And usually it's very rare that you find a patient only with lead mercury fillings that is a bruxer. Why? Because of this capacity that the top tooth had to make things fit. When did the problem start? And again, anecdotal, people are going to say, where's the evidence? I'm talking about my experience here, is that when you started using composite, composite is the white filling material. It's a resin that cures, hardens in the presence of light. Or ceramics, you know, where the lab makes a nice crown and fits that in, or an inlay or an onlay. There's another material that was widely used, which was gold. Gold's very expensive, but an amazing material. Very rarely happens that you find bruxers with gold. Why? Soft. Gold is very soft. It's a good material. It's pity we stopped using it that much. But having said that, the most commonly used materials for restorative dentistry around the globe today are composite or ceramics, both of which are roughly 5 to 7 times harder than natural enamel, so your natural tooth. So that means that if you have one or multiple of these fillings in your mouth, and it's not perfectly, the anatomy is not perfect, and instead of having this, you have this, your brain is like, oh, well, that's not good. Now, it won't hurt you. You won't feel anything on the tooth. But at night, when your jaw slides back a little bit, because your jaw is completely mobile, right? And TMJ is here, and it's very forgiving, your TMJ. And something is just not right, you know, as it would happen had you had no dentistry done. Your brain's like, hey, there's something wrong here. Grind it out of place. And that starts the clenching or the grinding. So let's just break down the difference between clenching and biting. Sorry, clenching and grinding. Grinding is when one of the muscles called the lateral pterygoid muscle actually works as well and does the sideway movement. So you've got your masseter muscle, that one, and your temporal muscle, two of the strongest muscles, pound for pound in the body, that pull up the mandible. So those are the clenchers that makes it go up, right? Biting, strength. And then you have the lateral pterygoid muscle that does the grinding. And when the three work are allowed to work, you have the grinding movement, right? But if the pterygoid doesn't work, then you just have clenching, which is just pressure. And that's when people wake up and they have big muscles here and they have to pressure stuff. And sometimes it's not evident in the teeth that you are a clencher. Grinding, after years, you wear and tear your teeth down. Now, I'm not saying that clenching or grinding is exclusive to people with fillings or dentistry in their mouth. Obviously, it occurs in nature as well. Highly stressed people, obviously. But I'm seeing a pattern over 2 decades of doing this in people with a lot of dentistry in their mouths that isn't gold or the lead mercury fillings. So to understand this problem, usually when a patient goes to a dentist, and that dentist is seeing multiple patients a day. So if you don't know, I'm the founder of slow dentistry. So we never see more than 8 patients a day, meaning we always do things slowly. We do it right. Biomimetic dentistry, which means that you really make it look like a tooth. That takes more time. Usually when a dentist does these fillings or crowns, they don't go in and check the bite before they start. They'll start straight away to do that filling. And they'll spend their time doing the filling. Let's say if they're in a rush, they'll do it in 20 minutes. If they, they want to do a great job, they might take more time. And the patient is there lying down with their mouth open. And at the end, they'll come in with that little paper just to make sure. That's when the end of the appointment is. And let's just say, for argument's sake, they should take longer to do that. Maybe they don't. Maybe they recall the patients. Maybe they don't. But almost always, and I've interviewed a lot of doctors, they don't check to see if the previous restorations were good. And for me, that's where the problem begins. So let's say that they get it right, but there's a previous restoration that's wrong. Then that means that the new crown or the new filling is going to be a little bit off. So dentists out there, always calibrate bite before you do a filling. And if it's the first time round and you're doing a composite or ceramic restoration, then what you need to do is perhaps after a week, get your patient back in and calibrate it, because maybe with the rotation of the jaw while they were lying down for an hour, when they sit up, the jaw hasn't completely come into position. And when they go home after a few hours and relax, they feel it a little bit high. And it's very difficult to get right first time around. So patients, don't judge your dentists there. It's very difficult to get it right. That calibration should happen. And I know, because time is money, that a large majority of dentists around the world don't do that. They just don't do it. And the patient looks at it, wow, this looks great. It feels great. There's no pain. It's so much better. My doctor did a great job. He was super nice. Everything was good. He said it will last me 30 years. I'm happy. Not understanding that that's fractionally higher, that there's no tools he has to know that it's fractionally higher, except at night when his brain is like, hang on, what's that there? And there starts the clenching. And it starts very gradually. And they will probably never associate it. And then their dentist, oh, you're grinding. Oh, well, yeah. Are you stressed? Who's not stressed right now? Everybody's stressed, man. You know, and so let's do a night guard. Just do a night guard. And then they'll take an impression or a scan and make you this night guard. And some will do it better than others. But notwithstanding, you get this thing that sticks in, which somehow we never needed for 2 million years, but now we need it. We have to have it. And it's a billion-dollar industry in the US alone. Now, here's a punchline. We don't do night guards for our patients. We don't make money off night guards from our patients. We don't sell them. We have them. Some very rarely, maybe, I don't know, 1 in 5,000, 1 in 6,000 might get a night guard. Why? Well, because we calibrate the bite. We check the bite. We look at the whole machine. And if that person is clenching or grinding, there has to be something that is not balanced in the bite. And it's not by adding a night guard that you're going to solve the problem. Now, if you add a night guard, one thing will happen. You'll protect the teeth. You will protect the teeth. You'll protect the veneers or the crowns or you'll protect wear and tear, 100%. But you won't stop the clenching. So any patient watching this that has a night guard and they're a clencher, not a grinder, can you tell me that you don't wake up feeling worse? That the pressure is even worse? But your dentist is telling you that it's protecting your teeth. So probably what you do need is calibration of your bite. Now, there's an awesome technology called the T-scan. I'm not endorsed by this company. I don't get shares in the company, but it's a technology that basically allows you to measure the pressure of the bite. We've been using it for 5 years now. It's an amazing technology. But even if you don't have that, just using that little paper, it's been around for 100 years, and spending time working around it, making sure that everything fits. And it doesn't take one session. It takes multiple sessions. And if you do these calibrations, you will find that most likely you do not need a night guard, and that your biting and clenching will diminish dramatically. And that has been the case in thousands of my patients over the years. And now, again, here's the punchline. I do this, it's part of my appointment. There's no money involved. It's something that just takes a few minutes to do. And every good dentist should spend a little bit of extra time to do this for their patients after their restorative dentistry. And that's slow dentistry. You know, take your time, and you don't have to make money from this because you're supposed to be helping people. And a lot of people might say, well, I can charge a few $100 for a night guard. Let's make a night guard. How about just spending a bit more time with your patient and getting that calibrated? Now, I want to talk about orthodontics. Orthodontics, braces, aligners, railway tracks, whatever it is, when you're moving teeth for cosmetic reasons, for functional reasons, for whatever reason, okay? Hundreds of millions of children have had this done. I've had it done. You're moving the position of the top teeth with the bottom teeth. And usually that happens together. That's why when patients say, oh, can't you just do the top? No, because the fit is very important. So dentists, if your dentist says you can just do the top, he's wrong. So when you're moving those teeth, you've got to get the fit, and it almost never happens. So let's say you've got a patient who's never had a filling, but has done orthodontics. At the end of that treatment, they need calibration, because then this might be like that, and that brain's like, hang on, what's happened here? Because a dentist, a human being that is flawed, interacted in nature. And maybe the teeth look great, everything looked fantastic. He brought you from a class 3 to a class 1, whatever. Amazing job. You're super happy. Everybody's high five. But you still will need the calibration. Okay? And that's why a lot of people start clenching, start grinding after orthodontic treatment. And we just need to look into this. It just takes a few minutes afterwards, just making sure that, and then with some selective grinding, polishing, you can help find some passivity in the bite, aided with or without technology. We use a lot of technology to help us with this. No night guard required. And this is a lot more necessary when orthodontists extract premolars, these teeth here, to gain space to accelerate the movement. Oh, you've got overcrowding. Let's take out the premolars to gain space. And it makes a lot of sense, but it's wrong. We need those premolars. You shouldn't be extracting premolars. A lot of dentists are not going to like this, but I don't care, because millions of years of evolution said you should have 2 premolars. Why are you extracting premolars to accelerate orthodontic treatment? Do you really need fast, straight teeth faster, or do you want them better? And not only that, when you're extracting the premolars, you're narrowing the archway. And that could also have consequences on airway. And what you really want to do is to be expanding the arch. More oxygen when you're breathing. So I'll talk about that in another chat. So definitely, you, the patient watching this, if you've had orthodontics done and you're grinding, go get some calibration done with an occlusion expert, somebody who understands this. And the result isn't having a night guard. It's having your teeth calibrated. If you have dentistry done, if you have extensive dentistry in your mouth, crowns, fillings, the white ones, all right, and you're grinding or clenching, go and have them calibrated with the person who knows what they're doing, even if that means grinding them down. And if you have metal ceramic crowns, sometimes you have to grind down to the metal, and maybe you have to make a new crown, but you need to get everything balanced. And watch how your life changes. Watch how the muscles rest and everything. We have physiotherapists. We treat a lot of athletes. You're calling us, what have you done? You've cured him. You've healed him. His back is better. His posture is better. Why? Because it all comes from the mouth. Yes, it all comes. Headaches have gone. His eyesight is improved. Yes, from a balanced bite. If a dentist has intervened in your mouth, the likelihood of you having your balance off is high. And this is mechanics, okay? It's nothing to do with aesthetics or biology. It's pure mechanics. All right, so last but not least in this equation are patients that are grinders and over the years have ground their top teeth and bottom teeth down with or without having dentistry in, and they've reduced the height of their teeth. So the top teeth and the bottom teeth used to be this high, and now they're this high. This wrinkle starts showing up a lot more, and the face closes more than it should, and you look a bit older, like me. And that's called the collapse of the vertical dimension. I will talk about this some other time as well. But there's one of the places where a night guard does help, because it will restore the height of the teeth. And that actually does help the TMJ. And it's the only therapy, the night guard therapy, that actually does alleviate the pressure and the tension. But that's different than having teeth the right height with the fillings and the restoration. So I'm talking when you've ground your teeth, all of your teeth down a lot. You don't have the fillings, you don't have the crowns, you don't have the bridge work, and you've collapsed everything. And again, be very careful. If you are an excessive grinder, you've ground all your teeth down, and you do have bridge work and crowns, you'll probably notice that those teeth are a lot higher. Why? Because the pattern, the wear pattern is a lot different. The wear and tear is a lot different. And that's why people with a lot of dentistry should most definitely calibrate their dentistry year after year, not just the cleaning, the calibration. And we've been doing that for a long time. And I'm putting this information out free. It doesn't require any money, no investment, just a bit of extra time, a bit of extra craft, love for your patients. It's free. You don't need to charge for this. I don't. Never have. So with that said, that's where that night guard to augment the dimension, to help open. And the treatment isn't the night guard. The treatment is a whole new set of teeth, caps over your existing teeth. All right, so crowns or onlays or veneers. And if you've got 28 teeth or 30 teeth or whatever, 32 teeth, every single teeth will have to be raised. All the top ones, all the bottom ones. It's a very expensive treatment, a very comprehensive treatment. I call it a full vertical smile lift, and that will restore the height of the teeth, right? And again, once that's done, patients don't need a night guard. But until then, and if you can't afford that treatment, that's the only time a night guard to open the space is required. But I hope that this helped. Calibration, very, very important. If you have any questions, feel free to write in the comments. I don't come here that often. I'm not a YouTuber, but I just wanted to put this, who knows, maybe I have a future in this. I just want to put this information out there for everybody, free of charge. Take good care of each other. Use this information wisely, and see you soon.